may begin tonight in our nation's capital as the House of Representatives is voting right now on a bill that would bring the longest government shutdown in history to an end.
Yeah, let's take a live look at the floor. Republicans say they expect this bill to pass and be sent to the president's desk. The bill does not extend Affordable Care Act subsidies, which is Democrats' main sticking point. Instead, it only allows Senate Democrats to lead a vote on extending them in the future. And it's a hot question these days. What's going to happen to health care premiums, especially for those covered under the Affordable Care Act, aka Obamacare?
That's right. And with no mention of a solution to expiring subsidies in the current bill, premiums could double for many enrollees. We're now joined in the studio by ABC 6 News reporter Brendan Ante. And Brendan, you talked to people here in the Med City about their thoughts on this Affordable Care Act, the situation in general. How are they feeling?
Yeah, Robin Mazie, most I talked to said they won't be affected themselves by the situation. However, they do urge those who are relying on Affordable Health Care Act subsidies to start finding alternative options.
It all started post-pandemic, where the American Rescue Plan and Inflation Reduction Act increased subsidies for Obamacare. The goal was to make health care more affordable in response to economic fallout from COVID-19. But with these subsidies set to end at the end of the year, those with incomes above 400% of the federal poverty level could see significant health insurance premium increases, which some in the Med City say can have serious consequences to those in the pinch.
I think they paid it enough. And, if things continue to rise, it's only going to pinch their pockets even more.
One person I spoke to in Rochester saying he hasn't seen any increases to his current insurance plan due to being on Medicaid, but knows others aren't as lucky.
Got a supplemental plan called F since I'm old, which is not available anymore, which basically eliminates co-payment. So I'm lucky. People who have co-payment have problems.
The real problem, according to one healthcare finance expert, goes back to how Obamacare is structured.
If you look at the ACA coverage, very high deductible, and many people face medical debt. And also you must jump through many hoops before you can get the care.
She's encouraging those now who rely on ACA subsidies to find alternative ways to get health care, like direct primary care, where patients pay directly to their physician, bypassing insurance companies.
It's about $80 to $100 per person. So family of four, that's about $350 to $400 a month. That is much cheaper than Obamacare plans.
By saying providers appeasing patients first should be the main priority instead of always following federal regulations.
I believe that will completely push down price and improve quality.
Now, Robin Mazie, President Trump has already floated a proposal that would put money from Obamacare directly back in the pockets of Americans so they can purchase better care. But as far as we know, no progress has been made on that proposal. Live in the studio, Brendan Antony, ABC 6 News.